Assalamu alaikum. My name is Dr. Mohsin Khan. I am working in Community Medicine Department of Rashid Latif Medical College. Today's topic is Health for All, for which we have prepared MCQs. First MCQ is: a rural health officer is tasked with aligning the village health services with the vision of Health for All by 2000. Which of the following best reflects the principle behind this movement? Option A: building more tertiary care hospitals in metropolitan cities. Option B is ensuring universal access to primary healthcare services. Option C is increasing medical tourism to improve national income. Option D is focusing only on eradication of communicable diseases. Option E is provision of safe water. Correct answer is option B, ensuring universal access to primary healthcare services. Question 2 is: during a policy review, a committee found that health outcomes in some districts remain poor despite the presence of primary health centers. This situation most likely indicates a gap in which essential element of the Health for All strategy. Option A: availability of expensive technology. Option B: intersectoral coordination. Option C: number of medical specialists. Option D: focus on hospital based curative care. And option E: provision of advanced medical technology at basic level. Correct option is option B, intersectoral coordination. Question 3 is: a health administrator is asked to design a program consistent with the Alma Ata Declaration. Which of the following approaches would best align with this principle? Option A: establishing specialized cardiology units in every district hospital. Option B: promoting community participation in planning and delivery of health services. Option C: prioritizing high cost curative treatments over preventive measures. Option D: reducing health services to only immunization campaigns. And option E: training of the healthcare providers. The correct answer is option B, promoting community participation in planning and delivery of health services. Next question is question 4. A district health survey in 1995 showed that immunization coverage increased to 85% and safe drinking water reached 70% of households. Which conclusion best reflects progress toward Health for All by 2000? Option A: improvement in social determinants and preventive healthcare access. Option B: achievement of complete eradication of communicable diseases. Option C: prioritization of tertiary care facilities in rural areas. And option D is exclusive focus on advanced diagnostic technologies. Option E: reducing health services to only immunization campaigns. The correct answer is improvement in social determinants and preventive healthcare access. Question 5 is: a medical officer notices that despite adequate medical staff, maternal mortality rates remain high in her district. Which principle of the Health for All strategy is most likely being overlooked? Option A is equitable distribution of health services. Option B: development of advanced surgical units. Option C: exclusive reliance on private healthcare. Option D: prioritization of high cost treatment. And option E: training of the healthcare providers. The correct answer is option A, equitable distribution of health services. Next question, question 6. In a seminar, a student argues that Health for All means every person will have the highest possible standard of medical treatment. As a faculty member, how would you best correct this misunderstanding? Option A emphasizes costly specialist services. Option B aims for a level of health that allows individuals to lead socially and economically productive lives. Option C means universal free tertiary hospital care. Option D focuses exclusively on eradication of infectious diseases. And option E aims to have accessibility to health services. The correct answer is option B, aims for a level of health that allows individuals to lead socially and economically productive lives. Question 7. A public health evaluation shows that a district invested heavily in hospital based care but neglected preventive and promotive services. Which consequence would most directly hinder progress towards health for all? Option A, increase in medical tourism. Option B, widening of health inequities. Option C, higher employment in private hospitals. Option D, growth of pharmaceutical industries. And option E, introduction of new technologies. The correct answer is option B, widening of health inequities. Question 8 is a state government set up well equipped district hospitals but neglected village level health workers and health education programs. From the perspective of the Alma Ata Declaration, what is the main issue with this approach? Option A, it undermines the principle of community participation in healthcare. Option B, it discourages specialization in advanced medical fields. Option C, it reduces the importance of curative services. Option D, it limits international support for health programs. Option E, it limits utilization of health services. The correct option is option A. It undermines the principle of community participation in healthcare. Question 9 is a low-income country successfully reduced under 5 mortality after prioritizing nutrition, sanitation, and maternal child health programs. Which key principle of health for all does this success best demonstrate? Option A, equity in access to essential health services. Option B, dependence on private sector hospitals. Option C, expansion of high-cost surgical interventions. Option D, medical tourism to generate revenue. And option E, availability of specialized healthcare providers. The correct answer is option A, equity in access to essential health services. Last question is an evaluation of rural healthcare in Pakistan showed that despite the presence of primary health centers, many villages lack trained staff and essential drugs. Which challenge to health for all does this most clearly highlight? Option A, resource allocation and implementation gaps. Option B, overemphasis on preventive care at the cost of treatment. Option C, reduced demand for local healthcare services. Option D, excessive dependence on international organizations. And option E, less training of healthcare providers. The correct option is option A, resource allocation and implementation gaps. Thank you.